Good afternoon, Landon Riley. Let's begin the warm-up session. Do you think nurses should attend continuous nursing education?
Absolutely. Continuous nursing education is crucial for staying abreast of advancements in healthcare. It enables nurses to refine their skills, learn new techniques, and adapt to evolving patient needs. Moreover, it's often a requirement for license renewal, ensuring nurses maintain competency and provide high-quality care.
What do you find rewarding about being a nurse?
The most rewarding aspect of nursing is making a positive impact on patients' lives. Witnessing their progress, from illness to recovery, brings immense satisfaction. Moreover, fostering connections with patients and families, and providing comfort and support during challenging times, is deeply fulfilling. Every day presents opportunities to make a difference, no matter how small, and that's incredibly rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When confronted with dissatisfaction, I approach the situation with empathy and professionalism. I listen attentively to their concerns, validate their feelings, and seek to understand the root cause of the issue. Collaboratively, we explore possible solutions and address any misconceptions. If necessary, I involve the healthcare team to ensure a comprehensive resolution. Ultimately, my aim is to reassure the patient, restore trust, and ensure their needs are met.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is empathy combined with effective communication. I strive to understand the emotional and physical needs of each patient, fostering a supportive environment, where they feel valued and heard. By actively listening and responding with compassion, I establish trust and rapport, enhancing the patient experience, and facilitating optimal outcomes. This ability to connect with others on a human level is fundamental to delivering holistic care.
How do you prioritize tasks in a fast-paced nursing environment?
Prioritization is key in a fast-paced nursing setting. I assess each patient's condition, urgency of care, and treatment plans to determine priorities. Critical tasks, such as administering medications and addressing acute needs, take precedence. I also consider patient safety, time-sensitive procedures, and collaboration with the healthcare team. Constant re-evaluation ensures adjustments based on changing circumstances. Effective prioritization allows me to deliver timely, efficient care while maintaining a patient-centered focus.
You can now start your OET roleplay.
Good morning, I am Landon Riley, one of the nurses working in this community health center. How can I assist you today?
Good morning. I'm here because I'm concerned about my mother. She's 80 years old, and lately, she seems to be withdrawing from social activities more than usual. I've also noticed that she's lost some weight over the last 6 months.
I appreciate you reaching out about your mother's well-being. It sounds like you're observing some changes in her behavior and health, which must be worrying for you. Before we proceed further, how may I address you?
You can call me Mihiraa.
Mihiraa, it's essential to address your concerns about your mother's health. Could you please provide me with more details about her condition?
I first noticed it about 6 months ago. At first, I thought it might be just a phase, but it seems to be getting worse. She used to be quite active in the community, but now she hardly goes out or interacts with anyone.
I see. Is she currently on any long-term medication, or does she have any underlying health conditions?
She doesn't have any chronic illnesses.
Has she been experiencing any other symptoms or health issues recently?
She did have a mild flu a few weeks ago. Other than that, she's relatively healthy.
All right, thank you Mihiraa for sharing that information. Given the changes you've described in your mother's behavior and health, it's important for her to undergo a thorough physical examination. This examination would involve a comprehensive assessment by a healthcare professional to understand her current health status. Additionally, certain tests such as blood tests may be necessary to rule out any underlying health conditions that could be contributing to her symptoms. This way, we can ensure she receives the appropriate care and support she needs to maintain her well-being.
I understand the importance of her seeing a doctor, but she might be quite reluctant in her current state. I don't want to discuss her illness with her and risk causing her more distress. If you could offer some guidance on managing her symptoms or suggest any medications, I'll ensure she receives the necessary care and attention at home.
Mihiraa, I completely understand your concerns about discussing your mother's illness with her, and I admire your desire to protect her from distress. However, it's essential to stress the importance of her seeing a doctor. A proper assessment by a healthcare professional is crucial for her well-being. Encouraging her to seek medical attention will ensure she receives the appropriate care and support she needs. While it may be challenging, having an open and honest conversation with her about seeking medical help can ultimately lead to better outcomes for her health. Your support and encouragement during this process will be incredibly valuable in helping her prioritize her health and well-being. Mihiraa, do you have any other concerns or questions?
Okay, I agree with your point. I'll talk to her about seeing a doctor. But do you think it could be something serious?
It's natural to have concerns about your mother's health, but Mihiraa, I am sorry to say that as a nurse, I'm not in a position to provide a prognosis. The complexity of her symptoms requires a thorough examination and diagnosis by a qualified doctor. It's important to remember that only a healthcare professional can determine the severity of her condition and recommend the appropriate treatment. What matters most right now is ensuring she sees a doctor promptly, so that she can receive the necessary medical attention and support. Your proactive approach in discussing this with her is commendable, and will undoubtedly contribute to her overall well-being.
All right, I understand. Thank you for your advice.
You're welcome. Before you go, may I have your consent to schedule an appointment for your mother Mihiraa?
Yes, of course. Please go ahead.
Thank you. I'll make sure to arrange that for you. Before concluding, let me summarize what we have discussed so far. Mihiraa, thank you for reaching out about your mother's well-being. It's clear you're observing changes in her behavior and health, which is understandably concerning. We've discussed the importance of addressing her concerns, understanding her condition, and the need for a thorough physical examination. While you're hesitant to discuss her illness directly, it's crucial to emphasize the significance of her seeing a doctor for proper assessment and care. Remember, only a healthcare professional can provide a diagnosis and recommend appropriate treatment. Your willingness to support her through this process is commendable, and will greatly contribute to her well-being. With your consent, I'll schedule an appointment for your mother to ensure she receives the necessary medical attention.